What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering some of the biggest difference between working the night shift versus working the day shift at a hospital as an X-ray tech. So recently, I've noticed, I guess it kind of comes down to the type of doctors or surgeons or what you have going on, because I've recently noticed influx of different kind of exams that have been occurring during the daytime and even the nighttime. We get involved sometimes in it. It mainly comes to just the new surgeons and the new doctors your hospital acquires and how they like to do stuff. Recently, I've noticed during the nighttime, usually we just do the ER, and then we have the floor with some morning ports. That's kind of what we get involved with every night. And then in the daytime, you have a bunch of the post-ops. You have a bunch of the two views that come from, when people get pacemakers. You get a lot of that mixed. Like sometimes they'll bring them down into the ER because it's the quickest. And then you have all the spine surgeries, the post-ops, the with C-collar, vertical, and usually at our hospital, we're at a trauma 3. For the longest time, we just had, I guess it was the surgeon or the doctor, like they would order post-op, but it would just be like one view of the C-spine, and that's all we would have to do. One or two. Or it would just say lateral, or just say AP, and it would just be to check the placement of the little one right here, or even the L-spine. And then lately, certain doctors or surgeons, I'm not sure what they are, have been getting very peculiar on the way they like stuff done. It's like with collar, with this, with that, which nothing wrong with that. It's just adding that a little bit more extra work to mixed, and it would be fine if that's where it ended. But the problem is they get to the point where certain surgeons especially want stuff perfect, and if it wasn't for that the patient was just fresh out of surgery and just got the rods in, and maybe they don't have pain medicine, or maybe the patient, and most of the time they're not even young, most of the time it's like older people who are struggling. They want everything, like they're asking a lot. And most of the time the people, like where I work at, the people who work in the emergency room are the ones who have to get involved with these patients, because like we have the main radiology, and then we have the ER radiology, and then you have the patient outbuilding radiology, which is their own little trifecta. So you have to like send for them, and it's like this whole little excursion that happens. So at nighttime we don't really have to do that because we don't have enough manpower. And some of these patients, like for them to get that level of view of, they want everything like erect with C-collar and all this, like you need sometimes two to three techs, because you need sometimes we get the nurses involved to have the patient standing up. Sometimes that by itself is hard enough, because sometimes the patient maybe they can't stand, or maybe they have scoliosis, or maybe they have some problem going on. Just throwing extra little things into the loop. And then I know sometimes you're like, Miguel, what if they send this or that, or they just did their best images? There's been times where this poor person gets sent back down to our hospital, down to the ER multiple times, because whoever's up there looking at the pictures is never happy with how like true lateral, some of these pictures. And sometimes our managers have to get involved, because like even he'll look at it, he's like, yeah, that's acceptable, just because it's off by like a little tiny millimeter, and he wants it perfect, like nitpicking and stuff like that. And it's gotten pretty bad. So that's something I'm looking forward to tomorrow in working day shift. I've usually just been working on the night shift, which I don't mind working daytime and picking up extra shifts during the daytime, but just lately all them spines are the ones that get me. I mean, I understand what they're looking for, but it's just so nitpicky. I understand, like with the C-arm and stuff, like you can adjust the tube, you can get everything perfectly like that, but most of the time post-op and all that, like it can be done. It goes from like a regular L spine that you could probably do within 3 pictures, at least in ours, which would maybe 30 seconds a piece, like not that long, to like I've seen it sometimes takes 5 minutes up to 10 minutes, because like they have to be very That's something you have to look forward to. Then we have the radiologist in-house, and I know our radiologists, if they're like everyone else's, the ones in-house, sometimes they could get very picky. Overnight, we use the overnight radiologist. Some hospitals have it, some of them don't. Those are a little bit more chill, more relaxed. They don't bother us as much. They'll read almost everything you've sent over there, and you just put notes, and they'll, won't bother you as much. Versus the daytime, they'll call you, be like, hey, what's going on with this? I need more details, or hey, can you reshoot this, or hey, this, and it gets very, very picky. And I mean, during the daytime, you have a lot of upper management, almost like quadruple the amount of employees at the hospital, which just between just getting to one end of the hospital, fighting elevators and traffic. In the night, you could probably be at the farthest place in the hospital within 3 minutes. And during the daytime, probably the fastest you would get, you're probably pushing 10 minutes. So it adds a lot of stuff like that. And then in the daytime, there's a lot of more active patients, as far as them moving around, doing stuff like that. And at nighttime, most of the time they're asleep. Even if they order a morning portable, sometimes you could shoot them and they'll just be sleeping. During the daytime, you have a lot of more of the extremities and extra stuff that comes in. Some of the doctors will order stuff like that because they're in the room bothering the patients. Overnight, it was just mostly just be a chest X-ray, because most of the time the doctors don't want to bother them. But then again, we at nighttime get cussed out the most, because we are required to go shoot the morning port before 5 a.m. within the 12 to 5 a.m. So we wake up people at an ungodly hour, and yeah, most of the time patients are in. So daytime is different. Most of the time the patients are doing okay, or in the daytime they ask a lot of questions. At nighttime they're all like gronky and they won't ask nothing. So that's just some of the things I can think of the difference. And yeah, it's been Miguel. We'll see you on the next one.